This drug is one of the very important remedy in our psychiatric cases. Maybe cases of schizophrenia, maybe cases of mania, maybe cases of mood swings, maybe a case of depression. This is not ignatia, this is not anacardium, this is not nux moscata, this is not natromure. The person is highly talkative, highly loquacious. This is not lachesis, this is not agaricus, or this is not cuprometallicum. It's an excellent remedy for the children who have got stammering. The child find so much difficulty with distorted face before talking. This is not spigelia. This is also important remedy for the person who has got marked hydrophobia, fear of water. The reflecting light creates a problem. This is not lysine. This is also very important remedy for the person who has got convulsions with consciousness. This is not noxomica. This is also very important remedy for the people who have got painlessness. Almost everything is painlessness. This is not opium. This is a drug belongs to the family Solanaceae. This drug is our Stramonium. Stramonium. This is one of the important contribution of Dr. Samuel Hahnemann for the psychiatric patients, for the psychiatric cases. This drug belongs to the family called Solanaceae. There are various common names like Datura stramonium. It's also called as thorn apple because the fruit which has got full of thorn like appearance, apple like fruits which has got full of thorns, you can see in the next slides. It's also called as a Jamestown weed because this was found abundantly a place called Jamestown in Virginia. It's also called as a stinkweed because this plant stinks, which has got a very stinking smell, but the flowers has got a nice fragrance. It's also called as devil's snare, a large flower. It's also called as trumpet flower. So like that, the many common names. The genus name is derived from the plant's Hindi name, Datura, ultimately from Sanskrit Datura, white thorn apple. The origin of the Latin name Stramonium is unknown. The name Stramonia was used in the 17th century for various Datura species. This plant is a native of Central America. It grows in a wasteland. In India also it is found all over, most in the street sides where I have dumped garbage. This plant grows, which has got a stinking smell. For preparation of homeopathic medicine, the fresh plant in flower and in fruit is been collected and mother tincture is prepared as per the homeopathic pharmacopoeia. It has got alkaloids, atropine, which is very similar to belladonna. It has got alkaloid iosamiine. It also has got alkaloid scopolamine. This has been proved by Dr. Samuel Hahnemann. There are many drugs from the family Solanaceae. We have belladonna, which is very similar to stramonium. We have got hyoscyamus, which is again similar. We have got Solanum nigrum. We have got Solanum lycopersicum. We have tabacum. We have dulcamera. We have got capsicum. This is in short introduction about stramonium. In this image you can see a thorn apple full of thorns on the fruits, and it has got a 4 chambers inside, and it has got a black seeds. The name Datura comes from the early Sanskrit word Dustura or Dhatura, which means divine inebriation. That means divine intoxication. So people consume this accidentally, they used to get intoxicated and they have got violent behaviors produced by this plant. This plant is highly poisonous. If you take in a large quantity, a death may happen. Sphere of action. Stramonium has got main action on the brain, central nervous system, circulatory system. It has got action on the muscles and sexual organs. Regarding the pathophysiological action, we can explain in 2 words. The main pathophysiological action is inflammation and congestion, which is very similar to our belladonna and aconite. Inflammation of the brain or the inflammation of the central nervous system, there is a sudden rush of blood to the brain leading to a congestion of the brain, the congestion of the central nervous system, leading to full of excitement. The person will have delirious phenomena. Person will be having hallucinations, delusions, maniacal behaviors, and finally convulsions. The entire force of this drug seems to be on expanding on the brain. This drug is mainly adapted to the young plethoric persons like our belladonna, like our aconite, like our sanguinaria, like our sulfur, full of plethora, full of congestions, specially adapted to the persons who are prone to have maniacal behaviors. The person is highly impulsive, person is highly irritable. That's called uncontrollable anger. This drug also adapted to the persons who are prone to have epilepsy, febrile convulsions, or febrile delirium. This drug is also for the people who are having stammering. This is in short adaptability of stramonium. In these photos, you can see a stramonium plant. You can see the shape of the leaves, and you can see a long, elongated flower, which has got a nice fragrance, but a plant has got a bad odor. You can see a seed or a fruit which has got full of thorns. The egg-shaped seed capsule is around 3 to 8 centimeter in length or in diameter, and which is covered with spines. When the seed get matured, or when the fruit get matured, which splits into 4 chambers, each with dozens of small black seeds will be there. This plant is highly poisonous. You can see the flowers, which is like a trumpet, a long elongated flower. Traditionally, this plant has been used as an anesthesia in olden history of medicine. So people used to crush the leaf, people used to crush the flowers and make an extract and used to apply locally as an anesthetic agent. We should be able to differentiate 3 important remedies from the Solanaceae family. Sometimes we get confused. Almost the 3 plants look similar. You can see the first one is a belladonna, Atropa belladonna, which has got somewhat purplish colored flower. Otherwise it is similar, and leaves shape is little different as compared to our Stramonium. You can see the second right-sided image, which is the image of Alzheimer's, commonly called as an henbane. The flowers almost resembles but different color. The flower has got some dots will be there. Then we have the down one is Stramonium, which has got a trumpet shaped flower. And this peculiarity of this flower is this flower mostly opens at night. The night is the aggravation you can see in Stramonium patient. They cannot tolerate dark. The night is an aggravation, which is one of the doctrine of signature as compared to the plant. It's also called as a devil's trumpet. A person behaves sometimes like a devil. The person behaves insane. The person behaves maniacal. These are some of the doctrine of signature you can consider for easy remembering. We'll see some of the important keynote symptoms of Stramonium in our day-to-day practice. The first key indication of Stramonium is delirium, a kind of loquacity. Person talks all the times. Person sings, makes verses, raves, which sometimes we get confused whether the person is belladonna or ISMS. Both are a remedy for delirious conditions. Belladonna is more of violent delirium. You can differentiate whether it's a belladonna or ISMS or Stramonium. The delirium is more of furious. The mania is more acute. While the congestion, though greater than ISMS and much lesser than belladonna. So, in delirious state, this may not be as severe as belladonna, but it is more than ISMS and less than belladonna, which comes in between belladonna and ISMS. There is a never approaching a true inflammation as you see in belladonna. A delirious condition, the person is full of loquacity, talks all the time with desire to escape in delirium state. So which is very similar to our belladonna, bryonia, opium, rustox, where the person feels that he wants to escape, the person wants to run away. Details of that we'll see when we're going back to the mind. The second indication about Stramonium, the person is disposed to talk continuously. We can say loquacity or you can say loquacious. Here it is different from lachesis. Lachesis person is jumping from one topic to another, non-stop talker. But in Stramonium, person will stick on to one word or stick on to one topic and he'll constantly talk or she'll continuously talking. Most of the time talking will be more of religious way. Incoherent talking and laughing. Person is constantly, his activities is more. Rapid talking. We have to differentiate other drugs for loquacity. Other remedies like cicuta, agaricus, cuprometallicum and lachesis. Stramonium is indicated for the people who have got praying constantly. You may be wondering why praying is something abnormal. Everyone is praying, but intensity of praying in Stramonium is too much. Non-stop praying, the constant praying. It has been described as a maniacal praying. We have got many drugs, orometallicum, who prays mostly because of a kind of depression. We have got pulsatilla, veratrum because of delirious state. We have got sulfur, a kind of hysterical behaviors. It is not only just praying, it is not maniacal praying, it is more than that. The person is beseeching. Beseeching is a kind of urgently begging, eagerly begging, anxiously begging to the God and praying. It's also person is entreating. It's a kind of pleading. It's a kind of requesting. So most of the time this is related to a psychiatric phenomena. It's related to maniacal behaviors where the person is praying, beseeching, entreating, a kind of pleading, a kind of asking, a kind of requesting. Most of these symptoms comes whenever females who have suppressed menses. It is not only for the females with suppressed menses, otherwise also the person is being described as a religious mania. One more characteristic symptom of our stramonium is person who desires light and company. As we said, the night is the aggravation. The dark is an aggravation. Cannot bear to be alone. He wants someone should be there. Like our bismuth, like our lycopodium. The person's, most of the complaints get worsen in the dark. Worsen when the person is alone. He'll get nightmares, night terrors. Person cannot walk in a dark room. Many times they sleep with light on. I have seen several patients. Maybe in the roommate 2-3 are there in the hostel. The one person who always wants light on. They get frightened whenever there is a light is off. Even they are in the deep sleep. The moment the light is off, they'll get up. That is a peculiarity of stramonium. They want light and they want company. Stramonium is excellent remedy for stammering. Person has to exert himself a long time before he can utter a word. He'll make a lot of exertion before he utter a word. Makes a great effort to speak with distorted face. Before talking, the face will be like a full of distorted. We have got many drugs for stammering. Important remedies: Spigelia, Bovista, Ignatia. Another indication of stramonium is delusions. We have got many drugs for delusions, but here person imagines all sort of things, that she is a double, like our baptisia, like our arnica, like our petroleum. A duality sense. Person have a delusion as if she is lying crosswise. She is having a delusion as if head has been separated from the body. Our body parts are separated, like our baptisia. Details of delusions we'll see when we going back to the mind, but this is an excellent remedy for the person who has got delusional disorders. Stramonium also indicated for the people who have got convulsions, especially a children, convulsions with consciousness. There are many drugs for convulsions, like our cuprometallicum, cicuta, iosimus, opium, oinantha crocata. Like that, there are many remedies. But convulsions with consciousness, there are only two drugs. That is Naxomica and Stramonium. Without consciousness, we have got belladonna, cicuta, iosimus, opium. This convulsion is renewed by sight of a bright light, or the reflection of the mirrors, or the sound of the water, or by looking at the water, or reflection of light through the water. All those things will precipitate convulsions. The person who cannot see a bright reflecting light, that will stimulate the convulsions. Stramonium is also indicated for the people who have hydrophobia, fear of water, with excessive aversion to liquids like our belladonna, lysine. Whenever the sound or the sight of water, which causes a spasmodic constriction of the throat, leading to convulsions. We need to differentiate lysine, belladonna, some extent phosphorus. Phosphorus person also cannot see a water. While taking bath, she has to close the eyes and take bath. That is a phosphorus. Another important symptom of stramonium, which is very similar to opium, there is a no pain with most of the complaints. Everywhere totally painlessness. As I've said, stramonium is being used as an anesthetic agent as in a traditional medicine. While proving, this has found that totally almost all the complaints are painless except hip joint, especially on the left side, which may be painful. Otherwise, totally painless condition which you see in stramonium, which is very similar to opium. Opium is not only painless, complaints of nothing. Another indication of stramonium is eyes are wide opened. The eyes are prominent. Eyes looks very brilliant eyes with pupils are widely dilated. The pupils are insensible. There is a pupils are dilated. Especially the pupil get dilated whenever the child is been reprimanded. That is a key indication of stramonium. Just like our belladonna, there is a sudden rush of blood to the face or the head. So the face looks very hot and red with the extremities are cold. Face is hot and red, the face looks pink like our belladonna, like our sanguinaria, with cold hands and cold feet, with circumscribed redness of the cheeks, like our sanguinaria, like our acetic acid. There's a whole blood is rushing to the brain, leading to a kind of congestion. There is twitching of single muscles or twitching of group of muscles, especially in the upper part of the body, also indicated for chorea. So we need to compare the twitching of single muscles or a group of muscles like our causticum, like our magnesium, like our calibromatum, like our plumbum metallicum. It's also indicated vomiting as soon as he raises the head from the pillow, or vomiting from the bright light, which is clinically not so much significant. We have got for the vomiting, we have got many other drugs like our Naxomica, Bryonia, Ipecac, but you can consider this is also indicated for vomiting after a bright light or after a reflecting light leading to vomiting. The person will be most of the time with shrinking look. Whenever you wake him up, the face looks like a shrinking, as if he's been afraid in the first object seen. A kind of frightened look you can see in stramonium. It's also indicated for the people who have got hallucinations, maybe of auditory hallucination, maybe of visual hallucinations. The details of that about hallucination we'll see when we go back to mind. Also indicated for the people who are very sleepy, but at the same time he cannot sleep. Sleepy but cannot sleep. The reason why, because the person has got marked fear of dark, the marked fear of being alone. That is the one reason he is unable to sleep. We need to compare belladonna, chamomilla and opium. Stramonium is also indicated for the people who are suffering from typhoid fever. This is not the first choice of remedy for typhoid fever, as we have got many other remedies with better indication for typhoid fevers like Rustox, like Iasimus, like Baptisia, like Gelsemium, muriatic acid. There are many drugs with better indication. We have its own points to differentiate. But stramonium can be thought as one of the remedy for typhoid fever with religious mania, with religious delirium as the concomitant to differentiate this drug from the other remedies. Stramonium is also indicated for puerperal convulsions. The convulsion is most of the time very violent, convulsion with consciousness, with a sudden rush of the blood to the brain, a kind of congestion of the head and face with cold extremities. You can think at the same time concomitant of religious manifestations, concomitant of more of maniacal presentation. That makes the difference between stramonium and other remedies in puerperal convulsions. It is an excellent remedy for insanity, mania with hallucinations, with illusions and delusions. Person sees ghosts, person sees animals, especially black animals. Person also sees angels. Person hears voices. Person is talking to the spirits. There is a delusion about its own identity. He is unable to identify who he is. There is a rapid changing from joy to sadness. There is a furious mental delirium with red face, with great loquacity. There is a great hallucination which terrifies the patient. There is a mania with livid behaviors, the mania with lascivious talk, the mania with amorous talks or amorous behaviors, a mania with religious manifestation. All these are the indication of stramonium in insanity. It's an excellent remedy. I have seen when I was working in one of the institution, there's lots of cases of psychiatry patients are treated by my colleague by giving stramonium. We have other remedies for insanity, Alzheimer's, veratrum. I have given stramonium in many cases of mania. We'll see some more indication of stramonium. Whenever the menses has been suppressed, that leads to characteristic mental symptoms. As long as menses flow is in time, she'll not have much of the mental symptoms like our lachesis. Whenever the menses has been suppressed, like lachesis or zinca metallicum, she'll have mental symptoms. Maybe mental symptoms may be of loquacity, a mental symptom may be a kind of mania, mental symptoms can be hallucinations or delusions. All these things comes whenever there is a suppressed menses. It's also indicated for tetanic convulsions. The convulsions is been aggravated by touch, or aggravation by bright light, or aggravation by reflecting light, like our cicuta. Last symptom, complaints appear diagonally, the upper left and lower right, like our agaricus, antimptart, ledum. We'll see some of the etiological factor for stramonium. Complaint starts after fright, like our aconite, gelsemium. Complaint starts after a shock, like opium, aconite, chamomilla, staphysagria. Complaints after puparium. Complaints from insanity. Complaints from sun exposure, like natrum carb, glonine, lachesis. Complaints also from suppressed discharges, like zinca metallicum, lachesis. Complaints from suppressed menses. Complaints from overstudy, like picric acid, gelsemium. Complaints from sound of water, like lysine, belladonna. Complaints from reflecting lights. Also complaints from retained placenta. These are the few of the etiological factor of stramonium. Stramonium mind. Practically useful remedy in cases of mania, in cases of schizophrenia, in cases of obsessive compulsive disorders or any psychiatric illness. The basic thing is the violence. It is like an earthquake. Stramonium will burst out. He is unable to control that. He have that biting cheeks. He has got that furious look. It's full of rage, full of destructions. And many times people are so scared to go in front of him. You can imagine a case of violent mania. It is episodic. Sometimes it will come down and suddenly it will come down. And it is different from Naxomica. Naxomica is basically a person who has got fastidious irritability. A basic nature is only irritable, but he has got aims. He has got something what to do, something he has got. He knows that he has to achieve. That is Naxomica. But Stramonium is purely a mental case. Person has got full of hallucinations, auditory hallucinations. He'll see dark animals. He'll see ghost. He'll see something is creeping around the room. There are duality sense. He feels he is two. He feels he is three, and very similar to our petroleum and baptisia. Someone like anacardium. Anacardium feels that something a devil is sitting and something God is sitting on the left side and right side. So in anacardium has got a confusion state, but stramonium has got duality sense. But only one thing is prominent is, if at all evil means evil, if at all God means God. So he'll follow that. He'll behave like a God, and full of praying, full of beseeching, entreating, praying loudly, a maniacal praying. If a stramonium child is full of distractions and throwing things, child is full of obsessive compulsive behaviors, child wants his toy to be in particular order, and full of running around the clinic. So that is the typical cases of stramonium. And stramonium person also has got hydrophobia. He cannot see water. The reflection of sunlight causes spasms. He cannot see the sound, he cannot hear the sound of the water, and all that thing triggering. Something reflecting like is triggering. He has got marked fear of being alone. Always wants someone should be there in the room. He cannot off the light. Dark is an aggravation. Always wants light. The moment is light off, he'll get up from the sleep. That is a typical cases of stramonium. Mainly, practically, it is useful in schizophrenia. It is useful in delusional disorders. It is useful in mania. It is useful in obsessive compulsive disorder and many of the psychiatric illnesses. Mental symptoms of stramonium. With two words, we can describe the stramonium mental symptoms: violence and aggressiveness. Everything is violent and everything is aggressive. Now you may be wondering, every drug is violence, every drug has got aggressive behavior. But in stramonium is more qualified, more peculiar in its manifestation. When considering stramonium, the idea of violence comes into our mind. It is not a disposition. This is not a constitutional feature, but this is a mental state which you can see in stramonium. There is a full of excitement. There is a full of rage. Rage is nothing but a uncontrollable anger. Everything is violent. The face looks wild. Face looks anxious and fearful. The eyes are fixed on a certain object. Because of violence and aggressiveness, the face looks flushed. Face looks very hot, full of congestion. But extremities are cold. There is a violent delirium. Violence is a mental state in stramonium. It has been described, stramonium is like an earthquake in violence. You can imagine an earthquake. Everything is shaken. They simply switch from rage mode to a normal mode. Sometimes violent and something silent, as if nothing has happened. They are very controlled and very nice, very sweet when nothing has happened, like our belladonna. The belladonna person is very nice, very calm and cool when they are healthy. The moment they are sick, they become very violent, very irritable. Here, it is switching between irritability and calm. They may remain calm in consultation room, but at times, time to time, they get fits of anger. The anger comes with the violence to the extremes of hitting, striking, and even to the killing. It is not the desire to kill, they just kill. They are unable to control their impulse. If at all some animals are there with the anger, they may kill the animals. They will complete the action of violence. They cannot suppress that. You can see in typical case of mania. I have seen several mania cases where the person is so violent, even the nurses are so scared to go to the patient. Sometimes even doctors are so scared to go and meet him. The person, we don't know what he will do. I have admitted several patients in our ward where they have got impulsive behaviors. At times we are getting so scared. I also used to get so scared to go with that patient. We don't know how he will behave. So much violence. That is the peculiar of Stramonium. They go ahead and detonate their anger by doing something very violently. Sometimes they may take a knife and they get an aggression or impulse to kill. Like alumina. They hit children, they hit their mother, they hit their father. They will attack suddenly and tremendous aggressiveness, which is a key of Stramonium. I have said this is a mental state. It may change us back to normal after some times, but it is a frequency mood swings, a more of maniacal, more of violence in their anger. There is no holding back when Stramonium loses it. The rage is quite like an insane, like striking, biting, tearing, cursing, but most especially smashing the things. Such a state may erupt suddenly and subside for a while, but person is not at all free from that state. Typically a chronic mania, relapsing again and again, relapsing frequently over a period of time. With a definite desires to destruction. They are prone to bouts of rage and they are struggling with that for few hours and they'll again calm down and to a different emotions. From the anger, they'll go to a different state of emotions like a state of lustness, a state of terrorness, a state of livid behaviors. All these things are keep changing, but anger and violence to the core. Now you may be wondering, what are the other remedies are there? Not only Stramonium, we have got Naxomica. Naxomica is basically a disposition. Basically a constitutional wise, the person is highly irritable. He is fastidiously irritable. A basic nature of Naxomica is irritable. But he has got some goal. He has got some desire. Because of that he get irritated. Very hard-working person. But nothing such things you see in Stramonium. Stramonium is a mental state. Ignatia, irritability is more of the hysterical manifestation. When the things are not happening according to her wish, she will burst out with anger. More of contradictory features you can see in Ignatia. Moscus is another lady. She is also highly irritable, which is more of hysterical phenomena. The person gets so angry, she'll scream and scream and scream and finally she'll become unconscious. That is Moscus. Kalikab, again a person who's highly irritable. He is with strict principle. Kalika person has got something right and wrong. He cannot manage in between. Wrong means wrong, right means right. When things are not happening, he'll get irritable. Platina irritability is more of haughtiness, more of superiority complex irritability. So this is how we can differentiate irritability of Naxomica, Ignatia, Moschus, Calica, Platina and Stramonium. Another mental symptom of Stramonium is fear. Stramonium individuals are subjected to all manners of terrors, delusions and hallucinations. And all these things, terrors or delusions or hallucinations, with the fear is an expression. They are usually dread at the night. They are very active and well behaved in the daytime. The moment sun sets, they have got fearful phenomena. Like a syphilitic expression you can see, full of destruction towards the evening time. They are fearful at the night. They are haunted by the terrors and horrors in their subconscious mind. They will tell you that, "Doctor, I hate sunset." When there is a sunset, that starts the beginning of darker time of the life. If at all you have a Stramonium friend in your room and you switch off the light at night, even in the sleep, the roommate who is Stramonium will get awakened with terrors and he'll jumps out the bed with a terror and he'll get up and on the light. Stramonium person who always wants the light should be there in their bedroom. I have seen many such patients. They sleeps with light on and they get disturbed when there is a light is off. They are awake in the dark room. Whenever there is a dark, they'll start seeing monsters and they'll start screaming with the horrors and the fears. They got not only fear of darkness, they got fear of mirrors, something reflecting on the mirror, which causes panic episodes. They got fear of being alone. They also get fear as if they have been roasted up. They have got fear of evil things, fear of dogs, fear of narrow places, fear of tunnels, fear of water, typical of hydrophobia. For the fear, you have got many drugs: aconite, phosphorus, gelsemium. Each drugs are different in its own expressions. We have arnica for nightmares and night terrors. There is a fear of shining objects. Stramonium patients will report that they feel panicky in a moving car if sunlight is flickering in between the rows of trees or through the fence. The reflection of sunlight upon the water is causing a fearful mental state. There is a great anxiety of hearing the running water. They also have fear of being injured. It is very interesting that the person is so violent, remedy, the person is highly impulsive, person is highly irritable, but at the same time he has a desire to kill others, but at the same time he has got a fear as that he is getting injured. So Kent's repertoire you can see under the rubrics: fear of animals, fear of ghosts, fear of angels, fear of departed spirits. Everywhere Stramonium is mentioned with high marks. One more peculiar mental symptom of Stramonium is hallucinations. They have varieties of hallucinations, maybe of auditory hallucination, maybe of visual hallucinations. They will have all sorts of hallucinations. These hallucinations are usually associated with frightful things. Hallucinations of animals. They will see dogs, they will see wolves, etc. They see animals wanting to see them. There is associated with delusions, something dangerous things, especially of animals, dark or black things. They imagine dark, they imagine black ghost. One of the characteristics, fear and delusions, always worse while waking. Whereas belladonna usually worse before going to bed. But stramonium always worse while waking. Stramonium has got great fear of darkness, great fear of being alone. Hallucinations of angels, hallucinations of departed spirits, hallucinations of devils. He knows that they are not real, but still that phenomena comes up. These hallucinations, especially at dark, at times this hallucination associated with aversion to bright light, which is highly painful. We need to differentiate hallucinations, other remedies like anacardium, cannabis, belladonna, ioscimus, nux moscata. There are many drugs, but hallucinations in stramoniums most of the time is fearful, or something dark things, something black things, something about animals, something about devils. In the introduction video I mentioned, stramonium is one of the important remedy for the psychiatric cases. One such psychiatric case is mania. It is useful in mania that is excited for some time. Attacks of mania comes in paroxysms. It is not just one episodes, which comes again and again with a suddenness. Very often we get confused whether to give a belladonna, whether to give stramonium. Belladonna in mania only in the initial phase, only one episodes, but when the episodes comes again and again, the indication of belladonna is lost. We need more superior remedy, that is stramonium. More violence, more paroxysms, that is the indication of stramonium in mania. Bell may do palliative, but it may not cure. But stramonium will definitely cure in cases of mania. His anger is not necessarily directed to some person, or it is not necessarily to do something, but it is more of uncontrollable anger. It is more of impulse. It is as if he has been possessed with some evil spirit, as if some evil force is there within himself and he is unable to control that. That makes stramonium individuals are so dangerous. Sometimes we may have to keep them in asylum, or sometimes we need to keep them in a separate room. We don't know when they are going to burst out, when they are going to be impulsive, when they are going to be destructive, when they are going to be killing others. The stramonium is known for the most destructive and most violent remedy in our Metromedica. Its fits of anger might go as far as having a desire to kill. During such an attack of anger, the stramonium person may bite you, may hit you, may kick you, may even scream or curse. That is the main thing, is destruction. The mania or delirium of wild in nature. The face is being distorted. The face becomes bright red. The eyes have got a wild look. And the congested face. There will be associated with hallucinations. He sees a ghost. He sees some dark animals. Every creeping thing comes in his room, which terrifies him. The eyes are wide open. The pupils are wildly dilated. He'll be full of talking with this mania. Non-stop talking. Continuously talking with one topic. So most of the topic about mania is religious talking. At times he may become moody, but again there is a loquacity continues with the mania. At one moment he may be laughing, at one moment he may be singing, and he making lots of faces. Another moment is praying. Another moment is crying. He has a peculiar photomania. He always wants a light. The locality of Stramonium is different from Lachesis. Lachesis person will shift from topic to topic, whereas Stramonium will stick on to the one topic and non-stop talking on the same topic. This is how you can differentiate Lachesis and Stramonium. One more mental symptoms of Stramonium is religiousness. This is not just simple religiousness, more of maniacal religious behavior. There are many drugs for religious behaviors like our orometallicum, lachesis, sulfur. But in Stramonium is more superior in that is more of maniacal religious behaviors. Stramonium feels either evil or good. Sometimes they behave like a god, sometimes they behave like a Satan. He is unable to control. The person is constantly praying, beseeching, entreating. With that religiousness, there is so much loquacity. The Stramonium patient clings to sanity and keeps the terror yet by constantly praying. He is having so much fear of dark. To overcome that, the person is constantly praying. It is not just praying. Initially the praying will be small, then he'll start praying loudly. Religion becomes an anchor for Stramonium, which he holds on to save his soul, soothes his mind, so he'll be constantly praying. You see in the rubric religious affections, in Kent's repertory, we have got Stramonium. Praying, delusions of religiousness, mind delusion, sinned, day of grace, sinned away of his Stramonium. Mind, insanity, religious, Stramonium, 3 marks. One more peculiar mental symptom of Stramonium is multiple personalities. A kind of delusion which typically you can see in schizophrenia, and our Stramonium is an excellent remedy in the management of schizophrenia too. Stramonium is prone to hear the voices of totally own personality. This often leads to the patient believes that he is possessed by one or several entities. He can hear one voice, he can hear 2-3 voices, and he will become shaky himself. He don't know what to do. The voices of Stramonium often orders him, often commanding him to do something. The voices will mock at him. The voices will abuse him. Unlike in anacardium, which has got 2 voices. One is a good and bad. Something good is speaking on his right ear, something bad is speaking on left ear, and personally, totally the anacardium person get confused. But in Stramonium is not like that. Something only one. There is nothing good or bad. He adopts a certain personality. He may feel like a superhuman. He may feel like a god, and he has a mission to save the world. There is nothing evil at that moment. God means only God. There is no confusion that something bad is telling. Whereas in anacardium, there is always shifting between good and bad or bad and good. But in Stramonium, sticking to the one. In anacardium, person will struggle between the 2 halves. But in Stramonium, if at all there is a delusion of commanding something to do, something good to do, something like a god, and he'll behave like a superhuman, and he'll start praying, beseeching, entreating, all such delusional symptoms you can see in Stramonium. Stramonium experiences a fear of dark. If at all Stramonium feels he's a god, and at the end he feels he's very light, like an angel. There is also delusion, as if body is cut into 2 halves. There is a delusion as if body has been separated. Delusion as if limbs were separated. Delusion as if 2 or 3 persons are there. These are the various mental states of stramonium. Stramonium as a child. Whatever the mental symptom we said so far, all those symptoms will be there. In addition, the stramonium children are more of psychotic children. They will have obsessive compulsive disorders or obsessive compulsive behaviors. Stramonium children want their toys in particular order. They want to keep their shoes in one order. They want to tie the shoelace in their own way, their own manner. That is a typical OCD feature you see in stramonium children. Stramonium children also hyperactive. They never sit in one place like our tuboenum. They will roam around the clinic. They'll pick the object. They'll put them down. They have purposeless behaviors. All these are the additional features which you can see in stramonium child.